Abortion is health care. That's a statement of fact. I've been repeating it a lot recently because though it is a statement of fact for a lot of Americans, even many who consider themselves supporters of women's right to choose an abortion, it does not feel true that abortion is health care. And that's because the anti-abortion movement did a very effective job over the decades peddling lies and disinformation about abortion. Polling has consistently shown that most Americans never believed the most extreme anti-abortion disinformation, that abortion is murder, for example, but it is a subject that made a lot of people uncomfortable. Most people who knew enough about back alleys and coat hangers understood that abortion was necessary, but it was also an uncomfortable discussion. Not only did most people not want to talk about it, relatively few were willing to actually defend it. So the loudest voices in the room were always the ones who were shouting about abortion, lies about abortion. Only now, in this brutal post-Roe era marked by stories of women who were bleeding out in parking lots and nearly dying of infections, losing their organs because their doctors were barred from giving them life-saving abortions that were needed to manage their miscarriages, only now, against this real-life dystopian backdrop, are we as a country beginning to understand that abortion is health care. The American Medical Association says it. The American College of Obstetrics and Gynecologists says it. The American Academy of Pediatrics says it. Every reputable medical or scientific research organization understands that abortion is health care. If you ban abortion, you ban health care for women. That has always been true. And the people behind the anti-abortion movement, the people who worked for decades to overturn Roe v. Wade, have always known that to be true. They know when they voted to defund Planned Parenthood that they are not only defunding abortion, but also yearly checkups, cancer screenings, birth control, basic health care for women. They know that banning abortion is banning life-saving care for pregnant patients who are miscarrying. And to be quite clear, they also know that forced birth of any kind for anyone who cannot or does not want to remain pregnant is immoral and is literally a human rights violation, according to Amnesty International and the United Nations. And they most certainly know when they pledge to endow and protect fertilized eggs with legal rights, which they do in Project 2025, that they would not just be banning abortion and some forms of birth control, but they'd also be banning fertility treatments like IVF that have helped helped families bring millions of babies into the world. They know all of this, and they do not care. Because the most foundational lie of the anti-abortion movement has always been that they are in any way concerned with the health and safety of babies. They are not. The very plain effect of every one of these wish list crackdowns that are now becoming reality is the same. Each one of these draconian anti-abortion laws exerts government control over women exclusively, not men. That's what they wanted all along, and that's what they're getting. After a quick break, I'll talk to a woman whose health care and fertility became subject to that state control and hear the story of how she's fighting back.